A very good morning to one and all. I, Dr. Isha Yashwardane, Assistant Professor in Department of Physiology, take this opportunity to congratulate you all and welcome you all to this profession where mind, heart and soul comes together. It is my privilege and honor to introduce to you our respected Dean, Dr. Sangeeta Rawat Madam. It is said, if your actions inspire others to dream more, learn more, do more, and become more, then you are a leader. The twin institutes of St. Govardhandas Sundardas Medical College and King Edward Memorial Hospital is blessed with one such leader, Dr. Sangeeta Rawat Madam, the Dean of our institute. Madam began her journey as a medical student at St. G.S. Medical College and KEM Hospital. She did her post-graduation in general medicine and super specialty in neurology at this very institute. Since Madam had a special interest in pediatric neurology and epilepsy, she went ahead to do her fellowship in pediatric neurology and epilepsy from Royal Children's Hospital, Melbourne, Australia, one of the largest pediatric hospitals in the world. In this journey of 4 decades at St. GSMC, Madam moved through the ranks of lecturer, associate professor, professor, and head of the Department of Neurology, along with being a chief epileptologist at this institute. Under her leadership and guidance, the department has escalated to great heights. It is one of the best equipped departments of the Mumbai and has all subspecialties well developed. It is one of the largest and busiest neurology departments in terms of clinical services offered. Madam is a pioneer in starting memory clinic in this institute, which is only kind in whole of Mumbai, offering services to dementia as well as non-dementia patients who have memory problems. Madam has also started stroke units in this institute. Madam has mentored many postgraduate students and has organized many neurology conferences and workshops. Madam has an illustrious research career with over 50 publications in national and international journals. Not just this, Madam's work has been published by many reputed local and national newspapers. Madam has also contributed chapters in textbooks of neurology. Madam is also an esteemed member of various medical associations where she holds a crucial position. On 1st January 2022, Madam took up the responsibility as Dean of this institute. Madam has a great vision for this institute and she wants to strengthen the 5 pillars of this institute: students, residents, faculty, ancillary staff, and patients. With this brief introduction, I now request Dean Madam to enlighten our young minds. So, I will just introduce people sitting on the dais. We have our respected Dean, Dr. Sangeeta Rawat Madam, Academic Dean, who is also Head and Professor in Department of Physiology, Dr. Dhangauri Shingri Ma'am, Professor and Head, Department of Biochemistry, Dr. Anita Chalad Ma'am, Professor and Head, Department of Anatomy, Dr. Praveen Iyer sir. Now I request Dean Madam.
A very good morning and a warm welcome to all of you to this Premier Institute of Medical Sciences. First of all, heartiest congratulations to all of you because you all have worked very hard and have reached to this institute, which is one of the largest in India as well as Asia, and is a premier institute for teaching the medicine. So today, all of you have worked hard to reach here. And this is the institute of 2,250 beds hospitals. We have immense number of clinical material, research opportunities, and there is no dearth of patients if you want to work hard. So that is the biggest advantage of being in this hospital, because it caters to all strata of patients, and the patient workload is so much that we cannot actually keep up to the our our hard work. Whatever hard work we do, still we are lack of it, because the patient has so much faith in this institute, and we get cater patients from all over India. It's not only Mumbai, not only Maharashtra, but also all over India. Patients have a lot of faith in this institute, and you are going to be graduated from such an institute where you are going to be marked always as SATE GSMC student, and that will be the biggest boon you will have when you pass out of this as an MBBS student. So I joined to this institute in 1979 as an MBBS student, and I was also sitting like all of you once and had listened to Dean's gathering. After that, I have not been in touch with undergraduates because I am a super specialty teacher. And after so many years, I am again addressing you. So I was asking Dr. Praveen Nayyar, what are the queries you will have? What will you expect from a dean? So the few things which I came to my mind is, first of all, initially, all of you are very smart, intelligent, but if you are only smart and intelligent, you should become lawyer. If you are only intelligent, you should become a researcher or a scientist. But if you are smart, intelligent, hardworking and dedicated, then you should become doctor. So I think when all of you come to this, you have all these four qualities, and which is very important to become a good ethical doctor. You should have integrity, you should have a conscience, so that you do the truth and you can have a good sleep at night. See, we are in a very noble profession, and we have got an opportunity to touch the human lives. Today also, so many patients here treat me or treat so many doctors as a god. They feel that we are next to the god. So this you will never get any other profession. Often you will compare with your engineering students or chartered accountant students who will start earning at 25, and you are still struggling, you will be still studying. But don't compare that. They start at 22, but they burn out at 35 because they have all the reasons of hard, pressure from the corporates and these. And I've seen so many patients, so many who develop due to this corporate world. They develop hypertension and many things which are much earlier age. But you will be starting late, but your innings will go even up to 60, 70. Like today, I'm still, one of the head of the institute. So your inning may start late, but it will continue. Secondly, you will also expect that when I've come to this, when I'm going to become, will I earn more or not? Everybody wants to earn in life, but you have to strike a balance. How will you strike a balance? Yes, you can earn unethically also, but ethically also. So that is very important. In our profession, you have to earn ethically. And always be in your concerns, whenever there is a needy and poor patients, please be generous. Like I have in my life, my husband is a cardiologist. Even I could have, when we passed out, we were one of the first DM couple of Maharashtra. I could have gone into practice, but my father was here as an HOE of pediatrics for 25 years. So since then, I had decided if my husband is going to earn, let me continue in the medical services in KEM and serve the poor patients. So somewhere I did strike a balance that I can help the poor patients, and if someone else is there for earning. But as a man, you have to earn, but always strike a balance. Even in your private practice, definitely if you have graduated, you are supposed to earn and you are supposed to look after your family. But please do it as ethically. Third thing which I think what she said is student pillar program, which I had suggested. Now when I joined, we used to have only a Mumbai city students. So I was in Jai Hind and whole of my batch joined here. So it was very easy for us. It was just a change of college. But now we have inter-city, inter-state and whole from India students are coming here. So inter-country also. So definitely all of you are coming to a new city. Some of you a fast moving city. You're coming to a highly competitive academic institute. As a 12th, your portion is this, but the whole board is at MBBS portion. So portion is so vast, you will be really challenged for reading so much, and that requires, I think all of you know, everyday hard working. Last month sitting in the room for 1 month and smugging is not going to teach you medicine. It has to be a everyday uh, hard working, at least 2 or 3 hours of concentrated reading. So what I have planned is a student Dosi program. So I want all of you to be our friends and not only students. So we will have a mentors for you, which will be from the clinical side for the first MBBS, because I don't want your same anatomy, physiology, your teachers, because you might have a hesitation in telling your problems to them. So we will have a mentors from the clinical side, we will have a psychiatrist on the counseling cell, and we will have a counselors. Now this is not only that whether you develop anxiety, depression or anything, but it will also be if you want to do a research. Ours is one institute where the research starts right from undergraduate students. So if you want to go in some competitive quiz, you want to represent our college into any other quizzes or any other poster presentation, platform presentation, you need to be guided and cultured, and you need to be taught how to way of presentation, how to write up a paper. So all that mentorship will be starting. We didn't have this in the official program, but definitely there were people who were helping and few students who used to come and ask for it. But now you will be officially assigned the mentors, and then you can approach them for anything at any time. That is one thing. Third thing, I'm totally against ragging. So I request, if there is any incidents with your seniors or with your colleagues, and if you find that there is any incidents of ragging, please make sure that very, very strict action will be taken. Any of you can come into my office anytime, whenever you have any problem, without an appointment. I will definitely make sure that I listen to you whenever I have a time during that day and try and solve the problem. So here there is a change in the curriculum, which Dr. Praveen was saying, that you have an ATCOM, which is called as an attitude. If I don't remember the thing is that you have attitude, ethics, and commercial things communication things together. So that means that you will have a year-wise. You will also have integrated programs. So you will have also ATCOM meetings every 3 monthly or 6 monthly, I suppose, where you will be taught about how to deal with patients. Now it is very, very important that you treat him as a human being and not that you are overworked. I see that very often with residents, because they don't sleep well, they don't eat well, so they become irritable, and that irritation goes on the patient and the relative. But you have to make sure that they are make yourself put into their position. Then you will understand, okay, their patient is admitted, they are so worried, they don't understand what is going to happen. So if you put yourself into their position, you will definitely calm down and talk to them quietly. So as a first MBBS student also, you will be exposed, if now the COVID pandemic is going down, you will be definitely posted in wards and you will have a clinical observership there. So you will start seeing patients right from first MBBS. That's what I think the new curriculum says. And also there is an integration program, which he said that whenever you are reading a theory, if that thing is not applicable clinically, you might just try to mug it up. But probably here we are now in the new curriculum, whatever you read theoretically will also be taught to you in clinical side. So even as residents, I always tell them, if you have seen a case of Parkinson today, read about Parkinson today only from your textbook. You will remember forever. So that's what you should also remember. If you are dissecting a hand today, read about it today only. If you want to dissect hand and then at the end of 1 month and you go and read, you are not going to remember it, and you are going to take a lot of hard work. So best is, if you know in anatomy and physiology, you know what you're going to teach next, read it before the class. If you read it before the class, you will understand during the class much better. You can clear out your concepts. So apart from this, what I would like to say is that you have come to a best institute. On clinical side, we have our departments which are center of excellence in so many things. Like in neurology itself, I have a 6 subspecialty developed. We have epilepsy center, which is one of the 4th ranker in India. We have done more than 600 epilepsy surgeries. Similarly, in gastroenterology, or I don't know to name, but every one of the department is like a center of excellence. We have center of excellence for rare diseases also. So there is no dearth of clinical material if you all want to learn. I know you are not going to be posted in the super specialty, but you can always pursue your MD and DM or NCH in the branches which you want. But if as a student, any one of you interested in learning a few days or learning or knowing the super specialty, they are always open to talk to you, and you can always attend their OPDs on whenever you have a free time and learn the super specialty to know what is your interest. Often it happens that at the MBBS you just want to mug up the MCQs, you don't want to attend the clinics. I think that has really changed, this MCQs. I know, but I can't help it. But for us, it was like we used to have in the evening, just go and see where is the good patient admitted, where is the, let's develop clinical skill ourselves. You may read MS Murmur 10 times in a book. You may hear on the video or you may hear on the YouTube. But unless you put Setho yourself and listen to it and memorize yourself and understand and remember, you will not be able to diagnose MS. So, just by going, why diagnose? Just do a 2D echo, it will know. That's not correct attitude. For us also, neurological examination is very long. I can also say just do an MRI and forget about it. But that's where the clinical skill comes, and that's where you will be differentiated from other hospitals, because here we have lots of clinical material, and if you don't use them, then you will be at lost. So you have come to a premier institute, which is for you. See, as a horse, we can take a horse to a well, but to drink wet water from the well is by the horse. So you all have come here. We are ready to feed you. You have to become a dedicated, sincere, hardworking doctor with a good ethics and moral. And if you do that, at the end, you will definitely come out one of the excellent doctors from this premier institute. So I wish you all the best. And if you have any queries anytime, please walk into the dean's cabin and I'll be happy to help you. Thank you very much.
Thank you, madam, for your words of wisdom and also for coming up with student Dosi group. I'm sure our newly admitted students will be benefited by it. Now I request Dr. Aritra Sanyal, Assistant Professor in Department of Physiology, to kindly introduce our Dean Academics, Dr. Dangali Shengwe, madam.
Very good morning to all the respected faculty sitting in the dais and in front of me, and all the students. All of you, congratulations and welcome. I am Dr. Aritro, lecturer from Department of Physiology. So it is my immense pleasure and honor to introduce to you our academic dean and head of the department Physiology, Dr. D.N. Shenvi madam. She is an excellent administrator, renowned physiologist, and most importantly, a beloved teacher, not only to our department, but to all the people in the college. Madam has done her MBBS from LTMMC, that is Lokmanya Tilak Municipal Medical College and Science Hospital, and further completed her MD Physiology degree from the same institute. Madam has joined after spending her initial academic years in Science Hospital. Madam has joined this KEM hospital and St. James Medical College. She has more than 35 years of teaching experience, along with numerous achievements and publications, especially in the field of exercise physiology. Madam has dedicated herself 24/7 for the welfare of the students. We are extremely lucky to have her guidance all the time. So I welcome you, madam, to speak few words. Thank you.
Good morning and welcome to all of you in this prestigious institute. I was always in science, and that time when I was having such address from the dean, all the time all the people were saying that we didn't get admission in KEM. But my luck, I got associate professor. As associate professor, I came in KEM Hospital or GS Medical College, and then for last 30 years I am in KEM. KM has a different legacy because it is a multi-speciality hospital, and that is the biggest thing. That's why you are very lucky that from your start of your career you are here. Madam has explained everything what we have because she was there from the starting. She is of my same batch, 1979. She did in KEM. Throughout her career was in KEM. So she has more knowledge of KEM than us. What I feel as academic dean is students at the beginning, because they are coming from all different parts of the states, Maharashtra and all India, they find it difficult to adjust to Mumbai. If they are localized, it is easy. But your 12th standard curriculum and our curriculum, which is now changed and which has many things in it, so you get difficulty in adjusting. And for that, our teachers are always there to help. There will be a separate talk on curriculum by the teachers where you have to understand it. But don't feel anytime that you are inferior to someone else and someone else knows better. Because here what happens, some people are fluent in language, but you can also learn as time passes. And there is one thing, that is Marathi, because the patients in OPD are usually speaking Marathi. So all India people have little difficulty. But we have in this new curriculum a separate classes for those who have difficulty in Marathi or language. So that is important. And don't feel that if you think like that you don't know. You will learn in 1 or 2 years and you will speak Marathi fluently. Second thing is computer knowledge. Some people are not exposed to laptops, then your computers. But we have a team in this, because in this curriculum we have foundation course where we develop these all skills, computer skills, your communication skills, your language skills. And in addition, for your growth, we have a part which is dedicated to your wellness and fitness also. You should not neglect your health because you don't get time. Now schedule is different and you don't get time, you don't eat. Don't do that because health is first important. And anytime you have a problem, right now, people might get feverish. You just contact your teachers. We have RT-PCR center here. Immediately you can do the RT-PCR rat test and you can take their help. Anyone in the department, teachers, all teachers from lecturers, demonstrators till the department help will help you. So don't just be behind or because your parents are not here, don't think that we are not there. We are there for you. And I feel that is important. The last part is you develop friends. That is very important. You have to have a group so you can share your whatever difficulties, your emotions. Everyone is not of same emotional status. Some feel depressed earlier and never feel that someone else has more knowledge and I have less knowledge. Knowledge is vast. Today we in physiology or madam in neurology, we have every day there are newer things coming and you are lucky because there is internet, Google, and you get the opportunity immediately to go home and see. Which opportunity we never had. We had to restrict ourselves to books. Coming to books, I think all the department heads and the teachers will tell you which books to read, which books are easy, because there is vast number of books in each field in your library. Also in the book stalls you go, but they will tell you from the basis of your curriculum which books you should read. And I think that is the thing which is very important. Anyone feels that anyone is troubled by anyone, please come to our Dean's chamber. I am there, madam is there, or you can talk to your HODs and your teachers. I am there till 6:30. You can come anytime on third floor. Thank you.
Thank you so much, madam, for your kind words. Over to you, Isha.
I just want to say a few lines. I think there are parents who are sitting upstairs and in a different theater and listening to us. I want to assure you that your child has got the best institute and your child will definitely excel to a best doctor. And if there is any problem, we are always there to help. Maybe either a psychological problem, academic problem, or a financial problem. We are there to help. So please feel relaxed and be happy that your child is going to come out as the best doctor in India. Thank you very much.
I would like to thank all our esteemed dignitaries for gracing this occasion with their presence. Now we'll take a short break for 15 minutes and come back till 11.